Thank you. Speaking about dry topics, this does run the risk of being somewhat dry. I'll be providing a lot of facts about different seizure medications, many of which you know. Hopefully the slides will serve as a handy review for you for most of the individual medications. So my objectives are to help but learn differences between anti-seizure drugs to allow optimal selection, become aware of common anti-seizure drug toxicities, and identify pros and cons of specific therapies. The term anti-seizure drug is becoming more favorable than anti-epileptic drug because it's recognized that the drugs we use for epilepsy don't cure epilepsy. But ASD, anti-seizure drug, is also falling out of favor because it's the same acronym used for atrial septal defect, et cetera. So the current preferred term is actually ASM, anti-seizure medication. Disclosures are mentioned here. I will discuss some off-label uses. Each off-label use will have an asterisk by it. I think we're all aware of the limitations of anti-seizure medication therapy. Fit in the most frequently cited epilepsy article in existence is the Kwan paper from New England Journal in 2000, where they looked at the response to anti-seizure medication therapy. 56% of their patients responded to the first drug. Of those who failed, 17% responded to a second. And of those who failed two, only less than 5% responded to a third medication. It's these facts that have been known for decades that led to the drug development program in the 70s and the 80s, which gave rise to a whole number of drugs for seizures. The problem was this same study looked at which is better, the old drugs or the new drugs, and they found the second generation anti-seizure medications were really no more effective than the first generation. So that was a bit sobering. The first generation, what I call the first generation anti-seizure medications, are ones well known to most people, except younger neurologists are becoming unfamiliar with many of them. But these are listed here. The second generation anti-seizure medications are listed here. I used to have ezogabine on this list, but that is no longer being manufactured or marketed. And then there's another category that I've referred to as specialty anti-seizure medications. These are medications that tend to be used for a limited